When patients are planning their vein treatment, they want to know how long they'll need off work so they can tell their employer, or if they have their own business, so they can make arrangements. So here's what I advise. Of course, nowadays, all the treatments I do are under a local anaesthetic and they're on a walk-in, walk-out basis with no major surgical incisions. So in theory, you could get back to work pretty much straight away, but there are a few things you need to consider. The first is, how would you get to work? After some vein treatments, there are restrictions and advisories about driving, and I will put a link above so you can have a look at my video on this subject. So in the first day or two, you may not be able to drive yourself to work. How would you manage on public transport? Could you get a lift into work from a colleague? So that's one consideration. Another consideration is your job one that involves a lot of prolonged standing in a hot environment? So, for example, I recently treated a chef who does a 12-hour shift in a hot kitchen. He's on his feet nearly all the time, and for that reason I suggested to him that he take a week off work. Of course, if your job doesn't involve prolonged standing, if it's at a desk, and if you're able to get up and walk around and move, and remember, walking is the best exercise after vein treatment, then you could get back to work very quickly indeed. The third thing to consider is your job very physically demanding? So, for example, if you're a fireman or if you work in the emergency services, could discomfort in your leg inhibit your ability to do your job? As another example, I recently saw a window cleaner and I advised him to have a week off work because I really wouldn't want him to go up high ladders with any form of discomfort in his leg. So, those are the three main things you'll need to consider when deciding how long you're going to need off work. Firstly, how would you get to work? Can you drive? Are there any restrictions? Secondly, does your job involve a lot of prolonged standing, particularly in an environment that's very hot? And thirdly, is your job very physically demanding? Now, of course, individuals will be advised by their own vein specialist about how long they should have off work. But fortunately, with modern non-surgical treatments under local anaesthetic, time off work is measured in just a few days rather than the weeks or months associated with surgical stripping. Well, I hope you found that useful. My name is Dr. Haroon Gadraj. Thank you for watching.